go through the talk, but then there is an opportunity for you to type in questions, which I'm happy to take at the end of the talk. For those who don't know me, my name is Danny Bega, and I'm a neurologist at Northwestern downtown, and I am a movement disorder specialist. And so most of what I spend my time doing is taking care of people with Parkinson's disease. I'm also involved in medical education. One of my favorite topics to talk about is actually complementary and integrative strategies for dealing with day-to-day life with Parkinson's. Rock steady boxing is an important part of that, as we've learned from what you'll see of a survey that I'll talk about of over 1,000 people who participated in rock steady boxing. So just because the audience is likely to be a mix of people with different understanding of Parkinson's disease, kind of have my necessary first slide, which just describes what Parkinson's disease is a little bit. It's a degenerative disease that primarily affects the part of the brain where dopamine is produced and released. And dopamine is a chemical that helps with normal movement. And so as dopamine gets depleted gradually over time with Parkinson's, it leads to physical symptoms that you can see sort of depicted in this picture on the left of slowness, stiffness, slow movements, sometimes tremors. It's a disease of aging, in that as people get older, the risk of developing Parkinson's is greater as people get older. We typically think of these physical manifestations, which we refer to as Parkinsonism, and those are the symptoms that we treat with dopamine replacement. But you can see from this puzzle here that sort of what encapsulates the life of someone with Parkinson's is more than just the Parkinsonism. It's this constellation of a lot of non-motor issues that people deal with as well. And you can't treat one part of this puzzle independently. You really have to deal with the disease as a whole and the person as a whole. And so what we often do is try and take each symptom and treat the depression and treat the cognitive problems and treat the Parkinsonism separately. But what I think is so outstanding and important about exercise is that it addresses a lot of these simultaneously. When we look at our the treatment paradigm in Parkinson's disease, you can see all of these different ways of dealing with symptoms, from pharmacological therapies, at the top of which is levodopa, which is dopamine replacement, non-pharmacological therapies, which is what we're going to be talking about with exercise, and surgical therapies. But in the end, the goals of treatment are to improve symptoms and to improve quality of life. None of the treatments listed here have been proven to slow down the disease itself or stop the disease, but exercise is a bit of an exception, in that there is some suggestion that people who exercise more actually do have a slower decline. We can't say that the same way about certain medications or about surgical therapies, which treat the symptoms. But exercise, while it certainly treats symptoms, it may even be slowing down the disease. So just to jump into that now, into exercise and what we already know, and then I'll talk about the survey that we did on rock steady boxing. So what we already have known for a long time is that there's some relationship between exercise and Parkinson's. We know that before people are even diagnosed with Parkinson's, in general, they are exercising less than people of the same age who don't get Parkinson's. And you could argue that that's because they have early symptoms of Parkinson's that they may not be aware of, that are leading them to exercise less. But we don't know that. It's also possible that exercise is in some way protective against Parkinson's. And if you look at men and women, this is a graph showing years from diagnosis of Parkinson's, going from -14 years. 0 is the diagnosis of Parkinson's, and then years into the diagnosis of Parkinson's. And what you're seeing in the dotted line at the top is where the average amount of exercise is for that age group. And you can see that as time goes by, people with Parkinson's are exercising less than their same age cohort, and that begins even before the diagnosis and continues after the diagnosis. Less exercise than their same age cohort. there was a study of over 100,000 people, following them for over 15 years to see which of them were going to develop Parkinson's over a 15-year period. And they found that those who did the most physical activity at baseline, and this ended up being statistically true only for men in this study, but they were associated with a lower risk of getting Parkinson's disease. So those with the most physical activity in men had a 30% less risk of developing Parkinson's disease. Again, we don't know from studies like this whether that is a cause or an effect, but it's a relationship. We did our own study actually using data from the Parkinson Foundation registry, which had over 2,000 people in it. This was from a few years ago. And we split the people into those who identified as non-exercisers, not exercising at all, low exercisers who identified doing 1 to 150 minutes a week, and regular exercisers, which we defined as greater than 150 minutes a week. And we found that if you followed those people for a year, this was people in our clinic and in other centers around the country, we found that 1 year there was better quality of life, better mobility, less progression of disease, less cognitive problems. All of that was true in the regular exercisers when compared to the low exercisers and the non-exercisers. So for everybody, regardless of whether you have Parkinson's disease, we know that exercise reduces fatigue. It improves mood by releasing endorphins. It improves cardiovascular health. It improves the immune function. It has anti-inflammatory effects. And it has, in certain forms of exercise, there are social benefits as well. But these are important things to highlight in Parkinson's disease, because if you think of that puzzle I showed, fatigue, depression, mood issues, those were all in that sort of parts of the puzzle that we may see as components of what makes up the disease for people with Parkinson's. And so you're already seeing that exercise can attack some of these somewhat difficult to treat non-motor symptoms. The issue with anti-inflammatory effects may be relevant because we know that there's some inflammation that occurs in cells in the brain that damages them in Parkinson's. And by reducing inflammation, we may be protecting cells. This point about social isolation or social interaction is important because people with Parkinson's disease, now forgetting the fact that we're all socially isolated right now, in general, people with Parkinson's have a tendency to be more introverted, to want to be around other people less. And exercise, especially in groups, can be very beneficial from a social standpoint. That's not possible right now, but it will be possible again in the near future. And then specific to Parkinson's disease, we know that exercise can reduce falls by improving balance. We know that just as people get older, there's a reduction in flexibility by about 10% for every decade. And more though, that's in the general population, and more so in Parkinson's disease, which causes rigidity as one of its main symptoms. So that can be improved with exercise. The range of motion at the hips declines just with age, and that can be important for taking bigger steps and avoiding shuffling. But in the end, the goal is to prolong functional independence, to reduce morbidities like falls, and to improve quality of life. If we think about it from a physiological standpoint, what's actually happening in the brain and in the nervous system with exercise, it's possible that as you learn new exercises, you're forming new connections in your brain. And so even with a degenerative disease like Parkinson's disease, a lot of the brain is still working well, and a lot of the brain is actually still forming new connections and developing. And you can use that, you can harness that power of the brain to form new, powerful, strong connections by learning new things and new movements. It can make movements more automatic. So we know that when movements when someone with Parkinson's has to think about a movement too much, sometimes that movement becomes really difficult. But when a movement can become more automatic through regular practice and routine, it can be easier to do. Exercise may promote growth factors in the brain, so chemicals that actually promote neurons developing. We know actually exercise releases dopamine. Dopamine is the chemical that's deficient in Parkinson's, and you still make dopamine in Parkinson's, you just don't make enough. But actually it can be promoted by exercise. And it addresses the mind and the body together, as I mentioned a few times now, the physical and the non-physical symptoms together. So when we looked at an initial survey that we did a few years ago, was to look at why do people with Parkinson's not exercise enough, and what are the barriers. We looked at 106 people who were low or no exercisers and 109 people who were high exercisers, so 50-50 really split between low exercisers and high exercisers. And what we found, this is a little, it's not showing up very well, but what you can see here is what are the things that low exercisers need in order to get them exercising. And on the right, you see what are the things that high exercisers need in order to get them to exercise. And you can see that in blue is what they need. And there's a lot less need in people who are high exercisers. So people who tend to exercise a lot tend to be self-motivated. They don't need a lot of things in order to get them motivated to exercise. What everybody seemed to want or need in order to get them exercising, whether they were high or low exercisers, was that the doctor recommends it. And so that's what I'm doing here. I'm recommending it. I'm telling you, and I'm telling my patients every day that they need to be exercising, that that's a priority. And that seems to make a difference. And so we need to keep doing that and educating people. Having a personal trainer or a significant other was another big one. Having someone who can be there with you or guide you and work along with you was a big motivator that really helped people exercise more. If we look at some of the things that were important really only in getting people who were low exercisers to exercise more, it was that they needed to be in a group interaction was really helpful, having an exercise buddy that would go with them to exercise classes, and shorter duration sessions of exercise were all more motivating for people who tended to not exercise in the first place. We found in the end, in terms of barriers, prior studies had said that the reason people don't exercise enough is they don't have time, they don't have access, or they're afraid of falling. While those may be legitimate barriers for some people, we actually found different barriers. We found that most people who were not exercising, it was because they were too fatigued, they were depressed, or they simply lacked motivation or needed someone to motivate them to do it. And again, there appears fatigue and depression, which I think are so important because they're so common in Parkinson's. I would say about 50% of people with Parkinson's experience fatigue and depression. And so if we don't treat the fatigue and depression, it's hard to get people exercising. So it's really important that we identify and treat those issues. But the counter of that is true too, that if we can get people exercising, it will improve their fatigue and their depression. So I think important elements of an exercise for Parkinson's are that it's some sort of goal-based practice where you're learning to acquire a new skill, because then you learn to develop new pathways in your brain. That it should have some sort of supervised environment with to help with learning through reinforcement. And it seems that that's something that patients actually want. Something that's enjoyable, of course, if people are going to continue to do it. If something social is ideal. Well-trained instructors who understand Parkinson's is important, and that the classes are appropriate to the level of the person in the class. And that brings us to boxing. So boxing is forced, intense exercise that's been shown to be studied, to be valuable in people with Parkinson's. And it has lots of elements that I think make it useful for Parkinson's. So it focuses on speed, on strength, on balance, on agility. So a lot of different elements that could be useful in Parkinson's. There have been only a few small studies of rock steady boxing for Parkinson's disease, and this was one of the first ones. This was 31 patients randomized to 12 weeks of boxing compared to conventional exercise. And the boxing group had significant improvements in their speed of gait and their endurance. And both groups improved in balance and mobility and quality of life. There have not been huge studies of rock steady boxing, which is why we decided to do a huge survey. We wanted to understand who are the people that participate in rock steady boxing? What are the demographics like? Why is not everybody with Parkinson's, for instance, participating in rock steady boxing? What are the motivators or barriers to participating in rock steady boxing? And what is the perceived impact on Parkinson's symptoms? I say perceived symptoms because we're doing a survey asking people what they feel like are the benefits, rather than actually being able to measure the benefits with any kind of exam in the survey format. We distributed the survey, we put it through SurveyMonkey, and some of you may have even taken it. It was distributed in 2019 through the Parkinson Foundation and through Rock Steady Boxing. We hoped to get 500 responses over 3 months. So it just shows you how motivated people were to answer a study, to help with a study on rock steady boxing. So this was what our study looked like. We enrolled 2,054 people who did the survey. And then we ended up with data on 1,709 people because some of them ended up decided that they didn't want their survey data in there. About 300 people either hadn't heard of rock steady boxing, didn't have Parkinson's who filled out the survey, or they had missing data, so we couldn't analyze their survey. So we were left with 1,700, which was still a lot more than we had even hoped for. Of that, we had 210 people who had never participated in rock steady boxing, to compare to 1,333 who were current participants and 166 who had participated but were no longer participating at the time of the study. And so we compared those groups, and we found that people who were participating in rock steady boxing, just a few basic demographics about them, they tended to be more likely to be white males, married, retired, and taking Parkinson's disease medications compared to people who were not participating. I don't know that that tells us a lot, other than that maybe the areas or the people who are aware of rock steady boxing maybe need to be, we need to be able to reach people of various demographics a little better. We find that most Parkinson's disease studies end up finding older white males as the main demographic. And again, I think that speaks to the fact that, well, to some degree, males are a little bit more likely than females to get Parkinson's, just slightly. But some of that is also just where these studies are being done and the access to care for some of the underrepresented minorities. Rock steady boxing participants reported more hours of light, moderate, and vigorous exercise compared to non-participants. They tend to exercise more in general. People who are not doing rock steady boxing tend to not be exercising as much in any fashion, not just rock steady boxing. And this is, I think, the most useful slide. The reports of improvement in symptoms. And you can see the percentage of people who reported improvement in one of these symptoms, who attributed improvement to rock steady. These are very difficult symptoms to treat with the medications that we use day to day. Am I still, you can still hear me? Because I just got a sign that my internet connection wasn't working.
It's cleared up now, okay. Yeah.
Good. All right. So a lot of these symptoms are symptoms that are really difficult to treat with medications. When we look at things like medications wearing off, the fact that a quarter of people felt like their medications worked better or lasted longer due to participation in rock steady boxing is really impressive. But when you look at some of the non-motor symptoms that we don't try to improve these symptoms with levodopa, things like dizziness, cognitive problems, anxiety, depression, fatigue. Sometimes these symptoms even get worse with some Parkinson's medications. And to see that those are improving, when we look at fatigue, 62% of people reported improvement in fatigue with rock steady boxing, or fear of falling, 61% of people, improvement in social life, 70% of people. That's just a quality of life assessment. You can see the huge impact that this is having. And these are big numbers of people. This isn't a study of 30 people. This is over 1,000 people who are reporting this. We had a couple scales because we wanted to be as objective as possible. This PDQ-39 scale is a quality of life scale. It's a questionnaire that asks about different functions in different day-to-day tasks with Parkinson's, where lower numbers on this score are better. And you can see that the group to the left with 25 as the average score, this is the group participating in rock steady boxing, compared to the group not participating, which was 36 was their final score. So you can see a 10-point improvement in this score, because lower is better, in people who are participating. Self-efficacy for exercise. This is a scale that talks about how able are you to exercise, how motivated are you to exercise. And you can see much higher numbers, which is better in this scale, in people who participate in rock steady boxing compared to those who don't. So the most common reason for participating in rock steady boxing in our study was when we asked people why are you participating in this, they said it was the Parkinson's specific nature of the class. That's what drew them to it in the first place. But it wasn't just a random program, but that it was specifically targeting and focused on Parkinson's disease. That was 85% of people in terms of why they did rock steady boxing. 58% said it was the group structure that really drew them to it. Among those who never participated, which was 12%, difficulty accessing a rock steady boxing site was the most common reason. These virtual programs can overcome that barrier certainly, but that's a common problem. And the majority of people who stopped, when you asked why they stopped, it was either an illness or a hospitalization, or again, location issues. So nothing specific to the class itself. And this was really impressive. We looked at previous participants and current participants and asked, are the benefits worth the price, knowing that the prices are different at every place where people are participating. And 90% of previous participants, so 99% of current participants said it was worth it. But surprised to say that even 90% of those who stopped participating felt it was worth the price. And then would you recommend rock steady boxing to others with Parkinson's? You can see 94% of previous participants and 99% of current participants said they would recommend it. I suspect many of the people listening to this is a bit of preaching to the choir, probably people who are already interested or engaged in rock steady boxing. For those who have been thinking about whether they want to participate, I think this is pretty compelling. So my conclusions, this is the largest analysis of rock steady boxing participants that has ever been done. And it reports improvement in difficult to treat Parkinson's symptoms like fatigue, anxiety, depression, fear of falling, things that we really have trouble managing with medications. Participants seem to like the Parkinson's specific nature and the group structure, and 70% report improvement in social life with it. So we got to get back to the days where we can get outside and interact with each other, because that does make a difference. And then rock steady boxing is recommended by the overwhelming. So that is all I've prepared. And with that, I am happy to take any questions anyone has.
So if anybody would like to use that chat feature that I showed at the beginning of the program, feel free to use that, type in your question. We'll give it a couple of minutes to see if, any pop up and go from there.
Should I stop sharing my screen to be able to see the chat box?
Okay, I've got a question for you, Dr. Bega. So Diane posted a question about her husband, Danny, basically stating that he has fatigue all the time and how to help with this.
Yeah, so the fatigue I mentioned a few times because it is the most common non-motor symptom that people with Parkinson's have. About 60% of people report fatigue with Parkinson's. There's a lot of things that can cause it, first of all. So number one is trying to understand what's causing the fatigue. If it's just the Parkinson's disease itself, then you may not find a cause. But first, it's about ruling out other causes. So bad sleep at night, for instance, can cause fatigue. There, it's important to distinguish whether we're talking about low energy fatigue or sleepiness fatigue. If it's a sleepiness problem, it may be due to poor sleep at night, in which case fixing the sleep problems at night can really help the fatigue. Sometimes fatigue is a side effect of depression, so making sure that someone doesn't need treatment for depression in order to treat their fatigue. And then, when it is, sometimes it's low blood pressure related. So in Parkinson's disease, there's a tendency for blood pressure to sometimes be a little low. If you're on a lot of blood pressure lowering medications, sometimes fatigue can be from low blood pressure. But when we think it's Parkinson's related, it's managed with both medications and with exercise. And so medications, the dopaminergic medications for some people actually really increase energy. I know that for a lot of people who are under medicated and we start them on medication or we increase their Parkinson's medication, sometimes their energy improves and they start to feel fatigue only when their medication wears off, in which case adjusting the timing or dosage of medications can improve the fatigue. But lastly, as I've mentioned throughout this talk, exercise. It seems like a vicious cycle where if you're fatigued, you don't want to exercise. But if you can you can force yourself into some exercise, it actually does have the reverse effect of improving the fatigue. So all of those things should be considered. Obviously, other medical issues, anemia, thyroid problems, other things can cause fatigue that should be checked out as well. But those are sort of the Parkinson's related fatigue tips.
Diane did state it. She said low energy.
Yeah. So yeah, low energy, not a sleepiness, then it's probably not a sleep issue. Then you want to think about those other points that I mentioned. But again, sometimes the medication can help. Sometimes more levodopa, for instance, in certain cases, in the right cases, can improve energy. But it also depends on how much someone is able to tolerate. And then sometimes exercise is the main way to treat it. Medications that specifically target fatigue are not great. They tend to be hard to get approved and be expensive, but some of them have quite a few side effects on cognition. So some of the stimulant medications that are out there can sometimes cause confusion and hallucinations, and so they're not used very often for that reason.
Next question from Sandy states, significant arthritis prevents me from exercising to the degree I would like to. How do I deal with the pain in my joints? I am taking meds currently.
Yeah, so dealing with exercise when you have arthritis, usually you need to work with a physical therapist or trainer who can really guide you in safe exercises that you're able to do. You can't just, so for someone like that, boxing may not be the best option. Sometimes aqua therapies are really good because they're easier on the joints. There are a lot of places that offer aqua therapy. If that's not for you, or if you've tried that, there are ways to exercise that doesn't put as much strain on joints, but you really need to work with a trainer or a therapist on that. And then, of course, anti-inflammatories and things. If you're on medications for arthritis, usually it's something like that to kind of calm down the discomfort. But you don't want to be doing anything that worsens arthritis, and so I think that's why it's important to work with a specialist.
Okay, from Todd, is there any scientific data that shows boxing reduces tremors or slows the tremors?
No. So when you're talking about specifically scientific data, you're not talking about what people just report. Rocksteady boxing was started by a guy who realized that it was helping his tremor. That's why he called it Rocksteady boxing. He looked at his hand and said, "My hand is steadier when I'm boxing." But that's anecdote. That's not data. We don't have a good solid studies that prove that boxing reduces tremor. The studies of exercise and boxing in general looked at, there are some small ones that looked at improvement in Parkinson's severity scores, which include tremor, but they were small studies, and so it hasn't been proven. Tremor is a pretty difficult symptom to treat with exercise because when your adrenaline is up, you might actually have an increase in tremor temporarily. It's not harming your tremor, but it's temporarily can be revved up. But that's not my first way of controlling tremor. Tremor, usually you need relaxing things, meditation, mind-body focused activities, and some medications and surgeries and things like that can treat tremor. Things that calm down your nervous system more than things that rev it up. So I would say not aware of that evidence for boxing.
Okay. Charlotte, I have pain due to PD, which makes it difficult to exercise. Will RSB help to really relieve some of this pain and make it easier to exercise?
Yeah, so similar to the arthritis question, I think, if exercise is hurting when you're doing it, you don't want to be pushing through pain because you could hurt yourself. And that's where you really need to be working with a trainer or a therapist on the kind of exercise you're doing. Other kinds of pain that are not musculoskeletal, they can be Parkinson's related. Actually, pain is pain just originating from the brain, from the chemical receptors in the brain, can be a part of Parkinson's for some people. And that actually can get better with exercise. It can get better with Parkinson's medications, with exercise, various things can make that better. And then of course, some medications can be used to treat pain. But I think again, it's that's so individualized because it depends on what causes your pain. But don't fight. You don't want to fight through pain while you're exercising, because you may be doing something wrong and hurt yourself without a trainer or therapist there.
All right, so currently that's all the questions that I see. Wait, one more. Just Diane just gave a comment just saying when Danny works with Corey or John, his focus is amazing for that hour. Thanks, folks.
Yeah.
All right. Dr. Bega, I'd like to thank you for your time, your dedication to the PD community, and allowing to spend the time out of your day to continue with education with this virtual ed seminar.
My pleasure. Okay. Thank you for doing this. Yeah.
So what I am going to do, Dr. Bega, if you wouldn't care to X out of your share screening, I am going to share mine. So for all the participants within this web series, I wanted to take the time just to share some additional information regarding Movement Revolution. As we go through these struggling times, we as a company are going to continue to provide exercise services as well as educational services. So with that, we're still working on, or continuing to do so, virtual online training that's specific to all of our clients. We utilize this same platform, Zoom, or we utilize what platform might work best for you. Also, we are working on our online exercise videos. Currently, we are doing a Rock Steady boxing class on Thursday, which is a little bit more moderate to high intense that you can participate in. And we're working on creating a bigger library with more exercise videos, as well as exercise videos, whether they be recorded or with a coach. Also, with educational and events coming up on April 30th, 2020 at 10 a.m. We are doing a world record awareness for Parkinson's disease. So a 5-minute video of exercising with people all around the world for 5 minutes in order to try to break a record. So we'd like for everybody to join in on that. And lastly, we are going to be doing a diet and nutritional learn with Angela. This is still to be determined, but we will definitely get that information out to you. If you have any other questions, please feel free to follow and like us on Facebook for program updates at Movement Revolution, as well as if you'd like to send us an email, you can email us at info@movementrevolution.com. Right. I appreciate everybody's time, and hopefully we will see everybody again for our next educational event. All right, thank you. Stay strong, stay healthy, keep fighting.